Hi, how are you? So our title is definitely done by Andrea Tennis. She is very creative when it comes to title IPs. And so Speaky, Demystifying the Challenges to Interprofessional Education Collaborative Practice. My name is Jenny Justin. If you don't know me, I am a nurse. I work in the nursing program, mostly in accelerated nursing. I do preceptorship in that course. And I'm also the executive director of CIPER. And in CIPER, I have about 50% allocated time to help coordinate interprofessional activities between all of our 9 health professions. And we do that on all of our campuses. So our general student population that we work with is over 4,000 students a year who are moving through the program. So it's a very large goal. And we're going to tell you some practical things that faculty and staff should know about IPE. When you're talking to students, when you're talking to each other, and get you thinking about other ways you could be involved. So those are our kind of goals for today, just things that we want to talk about. So put it in context for your role. Just some practical advice, and then engage faculty and staff across the professions, because we all do very similar things, work with similar students, and it's fun when we can be creative and collaborative. I am joined by Andrea Tennis. She's a chair of our faculty development team here in CIPER, and Amy Lounsbury, who is our staff member, who's going to tell you about a staff role. Oops, sorry. Didn't mean to smack you. All right, so what do we actually consider interprofessional education, or IPE? The actual definition we use is the same that the WHO uses, which is 2 or more professions coming together to learn about, from, and with each other. Broad, right? Broad. So how do we define it here at Creighton? We look at least a minimum of 2 of the health professions. Any health profession. They don't have to be inside of Creighton. So speech pathology is one that we don't have inside of Creighton, but it is someone that would make something interprofessional. And it can be student to student profession, or it could be clinical practice to student as well. So there's different scenarios. CIPER, which does coordinate interprofessional learning, is not the end of IPE education. So you should teach some of these things as well. You should teach team building and working together, and how you communicate across disciplines. Those are things that should exist in the curriculum already. They don't all have to come through CIPER. CIPER helps coordinate those things. And because we have some interprofessional learning spaces now, that's an area that we're trying to grow. How can we better use Warner? How can we use a simulation center in Phoenix? We have so many great health profession students to choose from that there's an infinite amount of possibilities. Not all universities and colleges have that opportunity to partner with so many different areas of expertise. So it's something very unique about us. And there's different ways to be inclusive. So we have activities that are done face-to-face, in person, with human being patients in front of them. Those are fantastic. We also have virtual education opportunities. So we can utilize different campuses, look at different communities. We have synchronous things that happen at the same time where everyone's in the same room. We have asynchronous activities where one profession might come in and then it gets reviewed by another profession and reviewed. So there's a lot of different ways that you can think of, how can I make this doable when we all have the worst schedules ever to plan around? And I can't think of one more way that we can come together. Now, with the Population Health Institute coming on board, there's another layer of expertise. So if you look at interprofessional education, we fit really well inside of population health, because population health is really working with healthcare teams. How can we collaborate to make the experience for the patient better and improve their outcomes? So it should be part of our expertise here at Creighton as well. So what about outside of Creighton? Yes, this happens lots of places. We're a center, which is a really nice, fancy way to look at IPE and accreditation standards at our university. Some places don't have the faculty or resources like we do, but they still have the same accreditation standards to meet. So they have faculty champions that are just trying to wing it on their own, and they don't have the same the broad amount of student professions to pull from. So sometimes they have to reach outside of it. We can do that as well. If we have a profession that's not well represented here at Creighton, there's no reason that we couldn't work with another healthcare provider that's not strictly the 9 that we have at Creighton. For instance, UNMC has a speech pathology program, right? And we work with them with the OT department to bring those students together, and it's very successful. There's big national centers that are dedicated to this area of study. So AIHC is one. There's a Canadian version of that. We have the National Center, and they have a ton of resources that are available, teaching resources. Also, they're like some of the nicest people you've ever met. They really like working in groups and in teams, and they make meetings actually enjoyable because they're willing to put an effort and work to find things that bring us together. So it's been a really fun thing to do. There's global interprofessional organizations. In fact, Kim Begley from Pharmacy and I are going to Doha, Qatar on Saturday. There's an Altogether Better Health Conference, which brings together global leaders in IPE. The United States and Canada are especially ahead when it comes to interprofessional learning and looking at outcomes and impact. But there's a lot of different places where they're doing a ton of work. The UK, Interprofessional Global is one of the big organizations, really cool. They're a little behind us, but they're interested in learning from us. So you have lots of opportunities there to be involved. Our big overarching group that really sets what determines the outcomes, what outcomes should you expect, or what should your goals be for interprofessional practice is IPEC. Largely, you probably know that already because it's written into the accreditation standards. But IPEC just did revisions. They're up on the website, and there's a lot more towards population health in there as well. So I threw a little trivia questions in throughout, and I'm interested to know if any of you know this. I do have prizes. What does IPEC stand for? Anybody got a guess?
Interprofessional Education Committee.
Oh, so close. Keep going on the C. There is definitely a booby prize. Those are judgments with Ruth Bader Ginsburg on them. They're mints. Collaborative, of course.
There's like 5 of us online. You come join me.
Well, that sounds lovely. Yeah, you can't win prizes over there. All right. So based on the new IPEC competencies, the things that came out, we thought, well, what is reasonable for a student at Creighton? So IPEC has their competencies that really relate a lot to practice and maybe towards end of graduation. Not all of our students stop CIPER involvement at the time of graduation. So we wrote our own of what are the expectations for our students who go through this program. This is weird because we're not a college. CIPER is a center. We have a curriculum committee, but we don't have the same kind of leverage that an entire program like nursing or PT or OT would have. So these are written for what our expectations are for students when they leave our center. And if you're not familiar, this is the basic process. There are 2 main courses our students take. One is the intro course, IPE 500. That is just, what is collaborative care? Why should I care about this? It is an intro foundational course, asynchronous, all online. We expect it to take about 8 hours, and it is a prerequisite to the second course, 001, Passport. That's the word you might know. IPE Passport. That is an experiential learning course. Students have to do 3 activities, like I got my passport stamped 3 times before they graduate from Creighton to get their degree. In fact, if they don't, even if they get an A in your program and they don't do their interprofessional credits, they should theoretically not graduate from Creighton University. Has that happened yet? No, because we're so good at our jobs. Because we can find an activity to get them through to, like, you are getting down to the wire. We have to get you into an activity, and we can do that. Now there's assessment that is required at each stage. So after 500, they do a retrospective pre-post study. or survey. That's a nationally one. That's usually what we do for accreditation. After the passport activities, they have to do a survey. You might know this because we're hammering it in. If they don't do the survey within 7 days of the activity, they don't get credit. No exceptions. You know why? Because there are 4,000 students in CIPER. So there are no exceptions. It is that. We'll get you a makeup if you didn't do it. And then there's one final survey at the end of the program so we can look at outcomes. So 500, again, all online, asynchronous, about 8 hours. This is a good course. We just revamped it. And it teaches a lot of things that are super relevant to what you're probably teaching. There's things in there about communication. There's things about there in population health versus public health. There's things about safety and quality. How you go through conflict, why should we care about compassionate, empathetic care? They're all different interactive modules in the course. And there are minimum expectations. You have to pass a quiz at each level, but largely get out of it what you put into it. It also does a little bit of teaching on what is passport, what are the requirements of you, and here's what we need from you. Encourage your students to do this and not wait to the last minute. Amy right now has just sent all of the champions in the different programs where their students are at in the IPE 500 process. And she's like, 24 out of your 37 students haven't completed yet. Now they have to the end of December, but they don't have to wait until December to do it. Might get benefit if they do it a little early.
I don't know if you can connect to the Teams. There's a lot of people on the team site. Oh, they're on the team.
I will allow my lovely assistant to handle that while I move.
Okay.
Now, in our passport repertoire, so this is the second course, this is the experiential, we have a lot of activities. Not all of them run every semester all the time, but we have over 100 activities that are approved as giving you credit for interprofessional education. We run about 25 a semester, fall and spring. There's a lighter calendar in the summer, but there is a calendar in the summer. We have virtual ones, we have in person, we have things that are hybrid, we have them across campuses. There's many different things and there's fall into different categories. So some are approved for just novice, never done it before, and then advanced beginner and competent. We also have different categories. So case study, community engagement, didactic, health humanities. So if you want to pick an activity for your student to be involved in, based on one of those things, we can do that and we can narrow down your list. In fact, I'm going to show you at the end where you can see the list, see all the different things so you know what we have. I'm actually going to go through kind of a highlight of what we do so you know what kind of things are you talking about when you say activity. So here's one. This is the Heart Ministry Center or Monin Center here. This one, it says summer, I put it under summer, but it runs year round. So this is one that is physical on the Omaha campus, and it is a fantastic clinic where, what populations do we have there now? We have OT, PT, grad nursing, med students can come there. Pharmacy is now coming back a little more. Dental, I think, is trying to make a touch point within the Monin Clinic. So there's lots of different opportunities for students to go in together and do real-time care with patients. That's a great experiential way to learn about teams in the center, and it's fantastic. St. Vincent de Paul, the Buddies program. So this one is on the Phoenix campus. If you're on Phoenix, you have 100% heard of it. It's utilized by almost all of the professions there. It's run by Dr. Tina Younger. She's fantastic. And it's similar to Monin Clinic. In fact, that they do care for patients in the community. And there's lots of different strengths. It is embedded for pharmacy as well. This one is over the summer. It's done by Margot. She leads this one out of nursing. So this is a really cool book discussion. It's asynchronous. It's online for the most part. And it gets rave reviews every summer that we run it. She picks a book that is a topic to healthcare, and then the students have a debate and talk about what their roles are from the different professions. Really interesting. And there's another fun piece of this that I'll get to later. Simulated mass casualty incident training. This one comes out of paramedicine. Andrew Eckhart is mostly in charge of this one, and it has EMS students. It's required for them. VD, pharmacy, trad, and accelerated nursing come a lot, but it's menu, I believe. So multiple people can sign up for it, and it's exactly what you'd think it is, mass casualty. And the students think this is awesome. They think it's one of the best things ever, but they get to work together to solve the problems and learn through those different things. So what do we do mostly in the fall? In the fall, some of the big ones that run, this is the Healthy Smiles program. This is between dental and trad nursing. This has been going on for a long time. Ashley Aubrey, Whitney Vandegraff do this. Ashley is a fantastic partner out of dental, and it's a dental CELIT program for school-based kids. Great one, team approach. Haunted Hospital, Heartbreak Hospital. I love this one because I know when we hold it, because it's either at Halloween or it's around Valentine's Day. And we use this a lot because it's a real quick IPE activity. It's a good novice activity. It's about a 45-minute commitment to do this one from start to finish. It's virtual. It's a room of errors. So you have a hospital room set up, there's a tour, and different specialties will pick out different things wrong. Interprofessional fall risk. This is one that started in Omaha between OTPT nursing and has since moved to Phoenix because it's such a great activity. This is one where it used to all be in person, and then it went to virtual because of COVID, and then has come back in person or even hybrid manners. But they're doing in-home assessments at assisted living facilities, and it's a fantastic way for them to work together. The LGBTQ health seminar, this one just ended for this fall. We just hosted it. It was a seminar. It's led by Dr. Marion Russell. It is a really interesting panel discussion looking at LGBTQ concerns. And one of the neat things about this is it is student-led, but faculty mentored. So you have faculty oversight of what is done, but the students keep it fresh by inviting different panelists, bringing different case studies that they bring together to do after the fact. Amy was just at it and said that one of the panelists was just absolutely fantastic. She's an attorney who has a child that transitioned in grade school, in elementary school, and gave her perspective on what it's like to have a provider who isn't sensitive or isn't qualified. She's like, if you're on the fence about should I, do this or not, she's like, don't do it. Or, we'll go find another provider that's supportive. So it was those kind of really fascinating things that students have a chance to ask questions about. This is purely menu and available to students. Highlighted spring activities. So this is healthcare professionals. Who are we? You might hear us talk about this one because it has a nickname. It's called Last Ditch. We have an activity that we reserve towards the end where graduation is required. And if we ever get to a place where if you don't have one last activity, you have one, we do this. So sometimes we run it, sometimes we don't run it because we don't need it for that time. But it brings together a whole faculty panel of experts who work through case studies and breakout rooms. Real fun. Phoenix First Place. I really like this one. It's a pharmacy-led program for developmental delays in autism, Down syndrome, other neurodiversities. And it's a place where they have it's a living situation and they train them. So a lot of the students will go and teach them about medications and how do you take your own medication when you eventually live on your own, and they can be observed. So it's a really nice clinic, and that one is Phoenix based. Thanks. Sorry. Not keeping up on that. One of the last ones, this is kind of spring, this is kind of summer. This is one of our bigger virtual activities. We do it between medicine and pharmacy. They're both required to do this one, and it's all implicit bias training. And it was done a lot off of Becky Nickerson's presentations that are related to Stonecatcher training. So we give them scenarios like, what if this happened to you in practice where there's just overt racism or by patients, by other team members? What would you say? What would you do? And it gives them options for how they would act in those scenarios. And they do it across professions. All right. So those are the things that we run. Here's some things that are new. And you can see I have stars next to some of them, and that's intentional. So number one, capstone ward simulation. That one's in Phoenix. This is a really cool simulation that medicine does. And they have an entire hospital ward. So they might have 5 or 6 patients, and they have pharmacy, nursing, medicine, PA, OT right now. Those are the different groups that we're bringing together. So it's just standardized patients, and you go room to room and do your assessments like you would in a regular hospital floor. And we have it all timed. So halfway through, one of those patients is probably going to code. Somebody's going to fall. There's going to be all these things that happen in the course of a day. It's just like a regular acute care hospital day, but you have all of these students working together to manage those different situations. So that was really good, and it's new. Stroke simulation in Phoenix, that was highlighted by the university for a while. That is an all-day IPE event where it's an unfolding case study scenario situation with someone who goes through a stroke. All the professions in Phoenix participate in that. Bedside music, that's an Omaha one. That actually, it's optional for any student who can play an instrument or like singing or doing anything like musical. So they can go to Mercy Hospital and do music visits, music therapy visits for patients. They go in, they introduce themselves, they start playing whatever music the person wants. Terrifies me, absolutely. But the students are incredible and they're exceptional. And they talk a lot about what their experience is with having different health professionals come into the room and interrupt every minute and hearing, your patient only hears one piece and then they hear something else and then they hear something else. So really cool. And it's a year. NICU experience. The medical group was really interested. They have in bringing students an interprofessional certification for the NICU. The NICU here at Bergen University is very interprofessional and done very well, where there's great interdisciplinary meetings. Students who do that will go to that rounding, and then they would shadow another profession for a period of time before writing a reflection. And that can be done during year round. Healing Gifts, another one. So this is a clinic that is also exists. I think it's the Lutheran Health Services, and it is just over here attached to Coons Memorial, a fantastic clinic. So in this one, if you were, let's say you're a paramedicine student, you will go in with another med student, and then you would present the case to a physician, just like a med student would. And you would talk about the assessment you did with the patient, what the plan of care is. Really great group. So the reason those have stars, I know you're wondering. Some of these need faculty champions. Currently, I'm doing all of these. If you feel passionate about one of these areas, NICU is not my expertise. I am an operating room nurse. Babies scare me to death, but I care a lot about the experience and want it to run well. If you are a faculty member that's interested in saying, gosh, that's my area of expertise, I would love to read student reflections. I could write a scholarship. I could do a manuscript around that. Fantastic. I would love to work with PA students or dental students that come to the NICU and what their experience is. Absolutely could run that. Bedside music, maybe you're a musician and you see the impact music therapy has on them. You would absolutely be a good fit for that one, or the Healing Gift Clinic. So if that's something you're looking to develop in your own career, please come talk to me. I'm happy to find the right fit. Questions so far? Sweet. I got another trivia question coming up. Hold on. All right. So who is in CIPER? Because this is kind of weird, right? What is our structure when we don't have an actual college? As we're a center. Well, there's the director, myself, and the program managers. Program managers, we have 3 right now. We have an open position in Phoenix. The program managers are our only full-time people in CIPER. I'm half-time. Then there's core faculty. Core faculty come from a variety of professions, and they work in different teams to help advance things we do in CIPER, grow things, change things, and we'll talk about how. The admin council, they drop in once a month and they give us advice and steerage and oversee some of the things we do and advocate for us at a higher level in the university. Then we have committee representatives. So we have a curriculum committee and an assessment committee. And it is important that it's not just a few people making decisions about interprofessional ed here. We want the input from all of the health professions. So we make that as interprofessional as possible. And then we have some student groups. Notably CSAC or CIPER Student Advisory Council. So students can work in that interprofessional team as well. And they give us input on, I think your IPE 500 course is crap. Or like, what we really need? We need this. We hear that a lot. Like, this would be better. Can you name our 3 program managers? Anybody? Bueller? All right. Well, I'd love to introduce. Oh, can you, Angela? Come on.
Program manager?
Yeah. Who's in CIPER?
CIPER Amy.
Amy Lounsbury, Shereen Sterling, Kate Martin Stricklet. All right. You get Ted Lasso mints. Awesome. All right. So with that, I'm going to turn it over to the fabulous Amy Lounsbury, and she's going to talk to you about staff in CIPER.
Thank you. You didn't tell me that I have to speak with a microphone, but I'll handle that. Okay, so I'm one of the program managers. I've been there since the inception of CIPER, so about 7 years. And I'm here to talk to you about what we, as a staff member, what you might, or what we look to you for in CIPER. So we want you to know that the dates are a challenge. We have a blend of many professions. And like Jenny said, there's 9 different schools and colleges that we deal with, and about 800 in IPE 500 in the fall, about 200 IPE students in IPE 500 in the spring, and then about 1,000 new passport members every fall. So we have 4 currently open IPE passport sites in Blue Line, and it can get quite confusing trying to keep everybody in the right cohort, in the right location, in the right graduation year. So we spend a lot of time. I spend a lot of time moving people around. Let's see. The due dates for IPE 500 can be established by our cohorts that we reach out to every spring or every fall and spring. So you can set that date. We don't, CIPER doesn't send any grades to the registrar's office until the end of the semester. So even though you may want your students to have it done before then, we're not going to submit grades until the end of the semester. It works out nicely for those students who, I don't know, don't get it done on time. There are a few. Let's see. And then I ask as a staff member that if you know if there are students in your cohort or your location that didn't progress or that are taking a leave of absence or a temporary leave or permanent, that you contact us if you know about it, because I try really hard to keep everybody in the right group so that when I send reports out to you, you don't have to spend a lot of time thinking or trying to figure out if that person is still in the right cohort. The next one up there is I guess that's to send the changes to the lists. That's what I'm talking about. If you have a student that drops out or moves to a different graduation year, if you could let us know that, that'd be great. Or if I send you information about that and you're not the right person, if you know who that person is, that'd be great if you could let me know that. Because as you know, the people change constantly. I'm trying to get the students, I'm trying to send it to the right person, and it can be kind of a challenge. Jenny said before, if you want to advocate an IV champion in your school or college, we'd be happy to help you with that, or to get you hooked up with the right person in CIPER. We're always looking for people to help. I'm always looking for people that are my contacts. If people don't show up for an activity, we need to know who to talk to about that. Or if people haven't finished their activity or haven't finished their IPE 500, we're always looking for those people who we can notify. Sometimes we send it to the wrong people. That's my fault. It's happened. The next thing on there is the participant lists. So the only way we know if someone has participated in an IPE passport activity is through our faculty facilitators. We ask the faculty facilitators to let us know who was there, and then we normally send out a reminder email for those students to complete their post-activity survey. And that's how they get credit. So they may show up, they may participate, but if they forget to fill out that passport survey, we don't even know they were there. So we really encourage you, if you're at a particular activity, to remind students even at that time before they leave the room to fill out that activity. We've been sending reminders, and sometimes we send 2 or 3 reminders, and we're going to try, hopefully, in the coming semesters to step back from that a little bit. We've been doing it for 7 years, and we hope that people are getting used to completing the activity completion report on their own. Students do not have to wait to get an email from us to complete that. They can go ahead and complete it right away. And the last thing that's on there is to memorize our email address. If you have any questions, if you need any reports, if you want to know where your students are in 500 or in the Passport 001, you can email me and I can send you a report for any location and profession. And that's it.
Yeah, like she said, we have several people in our center that could help. You don't have to, think that I should have known more about this or I should know. You can just literally ask. We're used to handling questions. We're happy to answer questions. Or if a student asks you a question and you don't know what they're talking about, just send them to us. We will clarify and can do it fairly quickly. So CIPER at Creighton.edu. All right, like I said, we have core faculty who work inside of CIPER. We actually have 7, I believe, core faculty from different programs on different campuses. And they work in 4 different teams: assessment of IPE learning, curriculum, faculty development, and clinical and simulated learning environment. So first is assessment. Both of our assessment people happen to be on the Phoenix campus. It's Kimberly Summers, who's a PT, and Jennifer Fierstein, who's a PA. They're working on a lot of different things, one of which is trying to assess student outcomes in IPE. Do you know how hard it is to measure collaboration? It's hard. And, trying to find a direct measure, a direct way to do it when we have so many different activities. How do you assess someone the same way in a book club that you would working at a clinic? Right? What are you exactly looking for? So they're trying to define that. In fact, that's a national conversation on how do we define learning and achievement in IPE. They're building towards that. The survey that's required for every single student to get credit, the activity completion survey, they're working on revamping that a little bit to get at the things that we need. We also have a Creighton Interprofessional Competency Evaluation Tool. It's a rubric that works really well for things like simulation. Trying to use that in different areas as part of a AACN grant that I'm doing with nursing and other ways. Situational judgment tests, like, here's a scenario of these options. Which one would you do? As a different way to see what level students are achieving at. I talked about CSAC a little bit, and they're doing a scholarship. They wrote a manuscript on the different campus cultures between Phoenix and Omaha. IPE here versus Phoenix, which has a building where everyone's collaboratively located and smaller, and Creighton's main campus, which is traditionally a little more spread apart. So curriculum is exactly what you would think. It's led by Kim Begley, who's a pharmacist, and Kim Barron-Scheffler, who's a physical therapist. She does Passport. And they're looking at the process we approve activities with. So that process might change. After doing this for 7 years, we have some data on what is really good IPE, what is the best way to go about it. For instance, the minimum is 2 activities. Really, we found that 3 activities or more are better. And the number one comment we get from students is, how come this other profession wasn't here? Like, how come these professions here? They notice when it's not as interprofessional and they want more of that. So they're looking at promoting that. They are also doing a national curricular study that looks really cool at the different models for IPE because we all do it differently. And we've built an honors curriculum for students who really want to focus on that and grow towards that. All right, trivia question. Approximately how many students take IPE 500 each year? If you were listening, Amy gave it away. Any ideas? Throw out a guess, you'll get mints. 1,000? That's correct. These are 19th amendments. Votes for women. You can pass that back. We have about 1,000 students do IPE 500. So the majority is in the fall. Almost everybody's doing IPE 500 right now. And then remember, it's a prereq for the activities. So then in spring, they'll start activities and work towards. We do not do IPE 500 over the summer, if you're asking. Some people have inquired about that. We do not. Clinical and simulated learning environment. So this is kind of new. We've had a clinical learning environment, but we're adding the simulation piece because we're trying to grow our engagement in Warner and the simulations we do in Phoenix. Lindsay Iverson just joined our team. She's a graduate RN and she's new to CIPER, and we are meeting on Thursday to talk about new goals. But we're going to look at assessment in the simulated learning area, and we are going to look at maybe some scholarship on clinical learning environments, looking at outcomes, and then what are the opportunities for us to collaborate? Because one of the cool things is that we have all these resources, why don't we share them? If you're already running a simulation where you do this and it would benefit from having another profession, why not work towards that? We're also working towards an interprofessional FLIPA. That started out of nursing, started a long time ago, and I've kind of continued to work towards it in Africa and hoping to do that next spring. All right, and I'm going to let Andrea Tennis talk a little bit about faculty development since she is the director there.
All right, thank you. Okay, so I'm Andrea Tennis and Wendy Carlton is in the PA program in Phoenix, and we are co-directors of the faculty development portion of CIPER. Some things that we have that are organized programs that happen all the time. One of them that I see some faces that are in this program right now are in the audience, the CIPER Associates and Scholars Program. It's a 2-year program. We had the first cohort finish and we are in the middle of cohort number 2. So put that on your radar if that is something that you are interested in, having 2 years of mentorship on something related to interprofessional education. If you develop a project, a program enhancement or scholarship. And as I said, the list of current associates and scholars are there, and then their mentors are listed as well, not necessarily in the same order, it's just a list there. But I also wanted to point out that we have some mentorship coming from Regis, and OT has a Regis pathway for our OT distance students. And the 2 mentors that are in Regis now were part of our initial cohort. So it's great to have some, as Jenny said earlier, some collaboration across different universities as well. And if you wanted to pencil it in, you'll get a lot more save the date information as we get closer. But August 28th of this coming 2024, the scholars and associates will be presenting what they've done for the last 2 years. I bet you their chairs will probably be there to hear about what they've been working on, but hopefully you will be there too. And that would be something that you can then hear the types of projects that they're doing if that's something you'd want to consider. Our next cycle for applications into the program would be in July. And then we would start off in October because we need a little bit of time to get mentors in place once we know who's accepted and what you're wanting to focus on. So one of the brilliant ideas of Cindy Costanzo that I will give her credit where credit is due is looking at how you're engaging. And this is not prescriptive in saying that if you are early, mid, or late career, this is what you should be doing, but it's kind of like a scaffolded approach that we have with our students too. We don't want every student to have only beginner or novice type experiences in their entire curriculum with IPE opportunities for them. So same thing goes with faculty. There are some things that maybe earlier in your career, many of our programs require all faculty to take CED 399 or 400. If you are somebody that is a passport facilitator, at least one faculty member on the passport has to take 400, which is a longer course. It's 8 hours. CED 399 is a 1-hour course. So hopefully that is enticing to you. Other things that are listed here, I'm not going to read them all to you, but it's just kind of a way to be able to see, even if you're just starting out and you're not quite sure what or how, there are ways to get involved, and CIPER as a team is more than willing to mentor you on any of those projects that you would like to do. The other thing that I just want to highlight is the fact that we have a journal here at Creighton as well. Yay. That is what CJCPE, that should have been a trivia question, stands for. Yes, Creighton Journal of Collaborative Practice and Education. So anyone right now should be reading it and seeing what is going on from a perspective of interprofessional education, but also being able to look at maybe that being a place that you would publish. There's a lot of delay, it seems like, when you're looking at interprofessional journals, and that was where we wanted to put our hat in the game to be able to look at that. We have a website, and I know sometimes with our web developers and the changes in our website, it can be a little bit challenging to find things on Creighton's website in general, but we have a bunch of information there. And one of the things that we wanted to highlight here is you can actually look at the passport activity list. And this is really important too, when we talked about what you can do in the different areas of your career, but also thinking about areas of practice, areas that you're teaching or that you're interested in. You can go and see what sorts of activities already exist. And maybe it doesn't mean that you then have to create a whole new activity from the ground up. You might jump on board an existing passport activity that is there and running. And if they're open to adding another discipline, then that is some place where you can find out about those things. So just thinking about that. Another area where you may want to be involved and share your ideas and perspectives and communication from your respective programs would be either assessment or curriculum committees. If you're interested in that, please reach out to us as well.
Can I talk about?
You can. You hopped in your seat.
Please do.
Okay, so remember when I said there are global opportunities for IPE as well? Collaborating across borders is an every 2-year conference. It's an international conference. And this is the Americans and the Canadians work together to host this, and they trade off. So last year was Canada's turn, and the next 2 years is the US's turn. And guess where it is? Omaha, Nebraska. We are hosting it. We won the bid. We're doing it as a joint host with UNMC. So Devin Nichols and myself are hosting it. And we are super excited to bring people from across the world to Omaha and show them all of our wonderful things, including the zoo. It'll be in May. It's going to be that sweet spot between Memorial Day and College World Series. So either the last week of May, first week of June, right in there. It'll be about 4 days. So if you're working on anything interprofessional and you want to do presentations, workshops, those things, or you want to be in a committee that helps forward the things we do and showcase, that's what I want to do. We want to highlight Omaha. We want to highlight Creighton. We want to really stand out. We plan to show them the new building here, some different social things. We're really excited about this because this is a big deal in IPE, and to have it here in Omaha at Creighton is a big deal. So please consider building your scholarship towards this. Who hosted CAB this year? It was in March this last year. Any ideas? Do you know? Oh, you get the mints. University of Toronto. And it was all virtual. We haven't had an in-person CAB for like 4 years-ish. So it's really exciting that the very first one that's all in person, no virtual with this, is going to be here. So fun networking stuff. I will also share with the journal. This journal is a very small, put together journal that's meant to fill this kind of niche coming out of the good works we do here in the Midwest. So it is very friendly to students and student projects. If you have graduate students that are looking to the first time publication and would go through the peer review process, it's very supportive. For instance, Margot submitted a journal article with a student on her book club that she does and is working towards publication. So not only is she taking an activity she does already, that's a passport, using the data she gets collected by CIPER, analyzing it, and then mentoring a student towards writing the manuscript, and it will get published, and it's open access. So anyone has access to that article and it can be shared for them. So lots of benefit there. Consider it. There's information on the website.